my end.
Okay, sounds good. We are going to go ahead and get started. And so with all of our user group meetings, just know that everybody is on mute, but please do feel free to ask questions through our Q&A, and Emily, Aaron, and Connie will be happy to answer them through that Q&A or through that chat, and any that they don't get to, if we have time left at the end, we will go ahead and answer them right during the meeting. But let's go ahead and get started. So today this is our Maternal Data Center user group meeting. And I did want to make sure everybody knew we are doing a couple of polls today. So please feel free to respond to those polls. We want to know who's participating in our user group meeting, and then what you think of it at the end. So that would be great. To get your input on that. Do know that we are recording this webinar, and we're going to be posting it in the Maternal Data Center section, and this slide deck has already been posted in the Maternal Data Center section, and I will be showing you that as part of this this meeting today. The other thing to know, this is what we call a user group meeting. And the goal of these meetings is really to introduce you to brand new features or new reporting requirements that we know about from external reporting organizations. This is not going to be a training. For those of you that might be new to the Maternal Data Center and you're not quite sure where to start, again, we recommend you go to our Maternal Data Center support section, and you will be able to find links to recordings for refresher training sessions. Or if you're brand new and you really want a one-on-one training session with one of our program managers, then feel free to reach out to us and then we can schedule that. Okay. But the goal of this particular meeting is around introducing brand new features for the Maternal Data Center. Today, very specifically, we're going to be talking about our revised Maternal Data Center landing page and the clinical measure section. We have also made some revisions to our Maternal Data Center support section. We want to introduce some new learning initiatives that we're going to be undertaking over the next 12 months. Talk a little bit about the performance reporting change that has been announced by the Joint Commission. We are going to be building several new items in the Maternal Data Center, and we're going to be seeking volunteers among our hospital users for those initiatives. And then we're going to get into the nitty-gritty and talk about our brand new 2-patient ID feature. And then, while this particular user group meeting is open to all of our users across California, Oregon, Washington, Alaska, and Montana, at the very end, we're going to have some California-specific announcements. So California hospitals, go ahead and hold on, and then everybody else is free to log off. Okay, so that's the broad brush. Let's go ahead and get started. And the first thing we want to make sure everybody knows about is the very slight redesign that we've made to the Maternal Data Center. Now, in case anybody's worried, it's not a significant redesign. It's more about moving the furniture around in the Maternal Data Center. Okay, what do we mean by this? Okay, well, first, let me give you some background. Okay, last fall, you may have been one of the individuals that participated in one of the user feedback activities that we initiated. And so we specifically undertook 2 different activities. First, we had an online survey for all MDC users across the 5 states, and we really wanted to get your feedback on your likes, your dislikes, and your suggestions for improvement around the Maternal Data Center. And then, with a smaller group of about 10 of you, we conducted one-on-one interviews that were facilitated by an expert in website navigation. And the goal of that is to have that expert actually watch some of you navigate around the Maternal Data Center and figure out how easy it was to use the Maternal Data Center for the purposes that you had, as well as get suggestions for improvement. And so the goal of this user testing and feedback was really to understand how you all are using the maternal data center in your daily work. And then based on those suggestions, try and do what we could to refine the maternal data center to really optimize your experience. Because what is so important to us is that you're able to easily use this information to drive quality improvement at your hospital. And we want to make that process as easy as possible. That is our mission here. Okay, so we took your feedback, and these are some of the changes we've made. The first big change is there used to be a hospital statistics section down in the lower right corner of your homepage for your hospital. What we heard during our user feedback interviews is that while the maternal data center was really pretty intuitive and easy to navigate, a lot of people didn't even realize that we were calculating basic statistics in addition to our performance measures. Okay. And we also heard that people felt like they just weren't leveraging all the information that was available in the maternal data center. So we made a decision to move these hospital statistics into the hospital clinical measure section. And in a few minutes, I'm going to show you how we did that, but know that that statistics section is now gone. So if you're used to going to that statistics section to find your rate of babies with neonatal abstinence syndrome, or you're used to going there to find your gestational age distributions, that section is no longer there. It's been incorporated into hospital clinical metrics. Okay. Now I'm going to talk a little bit more about the changes, and now I'm actually going to go to my slide deck, or I'm sorry, right to the maternal data center, and demonstrate some of the other changes to the landing page. Okay. The other change that we have made, and I'm going to amp up the size of this a little bit, is we heard that people really wanted to be able to set favorites among all of the measures, because we do have a whole lot of measures on the maternal data center. And that functionality has actually already existed in the maternal data center for quite a while, but people didn't realize it was there. So now, at the top of your landing page, even if you've never set favorites, you are going to be able to easily do so. So this is where you will see the favorites section. And we are going to give you a link to a user guide right here that tells you how to set your favorites. Now I'm going to go ahead and show you how to do it right now, because it is really easy. The way you set favorites, okay, is somebody at your hospital who has an administrator role in the maternal data center. Okay, it can be any one of the hospital MDC admins for your hospital is going to be the one to do it. And know that when they do set favorites, they're going to be setting the favorites for all of the MDC users for your hospital. So if one person sets 3 measures to be favorites, everybody else at the hospital that uses the MDC are going to see those favorites. Okay, so just be aware of that. Here's how it works. Click into under hospital clinical measures, click into by name. Okay, and let's say you all are really working on episiotomy rates. You will see by each of the measures, there's a faded out gray star. Okay, you go to the measure that you want to add to your favorites. Click on the gray star, it turns into an orange star. You go back to your home page. Episiotomy rate is now on your favorites. It's as simple as that. Okay. Once again, it's a hospital admin that does it, and it's going to be set for everybody at the hospital to see. One other recommendation we might make, there are already recommended CMQCC measures on your landing page. For example, NTSV cesareans is already there, severe maternal morbidity is already there. So there's probably no need to set those as favorites, but of course it is completely up to you. Okay. The other change that has been made is this live birth section where you can click in and see the count of live births by month. Used to be further down on the landing page. It was down in this section. Okay, it has now been moved up to the top right. So if you're looking for that, just know it's here. And for those that hadn't ever realized it was here because it was a little bit hidden, then just know that if you click in it, you're going to see a summary table of your live birth counts, or you can toggle over to your delivery counts because they're slightly different. Live births is the number of babies that were actually born live. Delivery is the number of delivering moms. Sometimes they're slightly different because of multiples. And you are going to be able to see by month the counts for years going back to however long you have participated in the maternal data center. Okay, I'm going to use my back button to go back. Okay, and just again, the live birth is now up here. Okay. Other changes. Okay. It used to be that when you wanted to go and see the entire list of MDC measures, okay, you would click into the hospital clinical measure header, and it would take you to the full list of over 50 measures listed in alphabetical order. Okay. Now that we've incorporated the statistics into the hospital clinical measure section, there are now, depending on your state, somewhere between 79 and 85 measures there. That's a really long list, and it's a little overwhelming. Okay. Thus, we have made the following change. When you now click into hospital clinical measures, instead of seeing that long list in alpha order, it is going to default to showing you the list organized into clinical topics. For example, cesarean delivery measures, vaginal delivery measures, overall delivery measures. And you can open and collapse each of these categories to find the measure that you're interested in. Whenever you click onto that header or into by topic, okay, the top topic is going to automatically be opened up to the measures in that particular topic, but know that you can scroll down and see the other clinical topic areas. Okay. If you are a WISHA hospital, your safe delivery roadmap measures are going to be the first thing you see that is opened up. If you're a California or Oregon hospital, you're automatically going to see the cesarean delivery measures opened up. But again, you can easily collapse it and go to any of the other topic measures. Now, if you're really tied to using, to seeing the measures listed in alpha order by name, that's still there. You just go over, use this tab structure and click by name. And there's where you can see the full list of measures, okay, in alphabetical order, okay. One other note while we're here, okay, there are several transfusion measures. There are the three right here, where the measure name used to start with hemorrhage. We went ahead and changed the initial word in that measure name to transfusions. So if you're looking for some of those measures, just know they're no longer going to be under the H's, they're going to be under the T's in the alpha order list. But of course, you can also go over by topic, and you can see the hemorrhage and transfusion measures right here. Okay, and then while we're here, I want to make sure everybody knows about this middle tab that sometimes gets forgotten, but this can be really useful for folks. So if you click on By Reportingorg, it will show you the measures organized by the performance reporting organization that you often have to submit the measures to. So for example, California hospitals will see all the measures that are publicly reported on Cal Hospital Compare. You can open up and see all of the Joint Commission measures in one place. You can open up the Leapfrog group, and not only can you see the Leapfrog group measures, but then we have a special report where if you do submit data to the Leapfrog group, then we have a special report that's formatted in a way that's very, very easy for you to enter your data into the Leapfrog group online survey. So just wanted to point out this third tab by Reportingorg because I think it sometimes gets forgotten. Okay. The other thing that we wanted to introduce today is our revised support section. And I've already referenced it a couple of times when I talked about this is where you're going to go to get the slide deck for today, and where the presentation recording will be hosted. So in the top black bar, there's a link to support. And when you click it, okay, you get to our support section. And one of the main ways folks use our support section is this is the easiest way to get in touch with us. So there's a button right up here in the upper right corner where if you click it, you can easily send us an email and it comes to our help desk and one of the members of our team gets back to you, hopefully very quickly, with an answer to your question. Okay. But the support section is more than just the easy way to contact staff. It is also full of user guides and where we put our recordings. So if you're trying to find out how to use a certain feature, then this support section can also be very useful. You can search it. Okay. Now, what's different here is, again, in our feedback survey and interviews with you all, we heard that the support section was a little bit overwhelming. And so we've done some revamping of it, ideally to make it a little bit easier to use. First thing to notice about the support section is it's divided into user guides that are very specific to certain maternal data center features. For example, how do you add and delete users? If you need to reset a password, how does that password reset work? Okay. Again, just like with the clinical topics, you can open and close each of the different categories. Okay. So that's the first tab, and that's user guide specific to maternal data center features. Second tab, trainings, webinars, and meetings, is where you are going to find the slide deck for today's meeting. So the slide deck has already been posted here. You can find that. And then likely within 24 hours, the recording will be finalized and it will show right next to it, just like it already does for the March 2019. You can see both the slides and the recording. So we will be posting the recording for today's meeting right here. Okay. User group meeting slides are here. I referenced the fact if you are brand new to the maternal data center and you would like to know more about how to use it, we do have recordings of our refresher training webinars that we would recommend you use. Okay? And then other often topic-driven webinars, for example, around unexpected newborn complications, severe maternal morbidity, and so on. Okay. And then the other thing I want to highlight is the right-hand side of our support section now has a section dedicated to if you are new to the maternal data center. So, and for those support guides that are really most frequently used. So a guide on how to use the reports, how to add users, the data file specifications for the core files, how to designate your favorite measures, and so on. And then also the refresher training also happens to be listed here. So if you are brand new, this is always a really good place to start with some of the key functionality that you'll need in the maternal data center. Okay, with that, I'm going to head back to my slide deck and scroll down here. Okay. The other thing that we heard from you all in our feedback sessions is that you really wanted to learn more about how to leverage the maternal data center. You knew there was a ton of information in there, and sometimes you just weren't sure how to find it and how to use it. Now, we're going to be rolling out a whole bunch of different features over the next 6 months. Okay, but in addition to new features, we're going to be amping up our communications and some of the webinars we do. So starting in February, we're going to have a 2-webinar series on using the data in the maternal data center. We're going to kick off on February the 27th. And in this morning's email that everybody should have gotten, you will see a registration link in this morning's email for that webinar. And this is what we're calling Quality Data 101. And it's designed to be a primer on the basics of performance measurement. So why do external organizations want hospitals to measure performance? Who's the Joint Commission? Who's the Leapfrog Group? How do you calculate a measure? What do you mean by a fallout case? So basic terminology and basic information about how to interpret measures. Then we're going to follow that Data 101 measure with a March webinar on how to use the Maternal Data Center for quality improvement. And this is going to be one in which some of our member hospitals share how they use the MDC data to actually drive quality improvement. So if you're thinking about, well, which of these 2 should I join? Okay, know that the February webinar is going to be how to understand and interpret quality measures. And the second webinar is about how to use the data to actually drive QI in your hospitals. Okay. And so feel free to attend both of them, of course, but know that the first one is going to be very basic introduction to performance measurement. Okay. In addition to those webinars, starting next week, we're going to be sending out a monthly email highlighting a measure of the month. And this is based on that feedback we got that sometimes you all weren't aware of all of the different measures that we do host in the Maternal Data Center. So this is going to be where we highlight one of those measures, tell you where to find it, how you might use it. And so look out for that starting next week. Okay. And then coming soon, under development now, for all of you that are new users, or again, just feel like you want sort of a basic introduction, we are developing some interactive online trainings for the Maternal Data Center. Right now, we have the recordings from our refresher training webinars. This is going to be a little bit different because they're going to be shorter, and they're going to be guided trainings that will show you, hey, how do I go find a trend line for my NTSV C-section rate? And are going to ask you to be interactive with that module. Okay, so know that that is coming soon. Okay, so those are all the updates that we have around the redesign of the Maternal Data Center. So let's move on to some other topics. And the first thing I wanted to talk about was the Joint Commission has recently announced an update to the way that hospitals submit their perinatal core measure results to the Joint Commission. Okay. And essentially, this is starting with 2020 data, hospitals will be required to use the Joint Commission's Direct Data Submission Platform, and they've given it the acronym DDSP, to submit not only the eCQM measures, but also the perinatal care chart abstracted measures. So this is the chart abstracted versions of PCO1, early elective delivery, PCO2, NTSV cesarean deliveries, PCO5, exclusive breast milk feeding, and PCO6, unexpected newborn complications. As a side note, PCO3, antenatal steroids, and PCO4, newborn bloodstream infections, have been retired by the Joint Commission as of January 2020. Okay. Now, going back to this idea of their new direct data submission platform, okay, what this means for hospitals is you all very likely have existing vendors that submit your perinatal care measure data to the Joint Commission for you. So for the remainder of your 2019 data, and specifically Q3 and Q4 2019, your vendor is going to go ahead and finish off submissions on your behalf in January and April 2020, respectively. Okay. But then, starting with the Q1 2020 data, which will be due to the Joint Commission in July 2020, the Joint Commission will require hospitals to manually enter chart-abstracted aggregated data on a quarterly basis using their new platform. Or I probably misspeak. It's not a new platform because it's been used for ECQM for a little bit, but it's now also going to be used to enter the aggregated data for the chart-abstracted measures. And by aggregate data, the Joint Commission means they want monthly totals of the total number in the numerator, the total number in the denominator, the total number of cases that were excluded from each measure, and so on. Okay. This is different because under the old vendor-submitted system, your vendor was actually transmitting patient-level data to the Joint Commission. Now it's going to be monthly aggregated counts. Okay. If anybody wants to see the Joint Commission's announcement around this, then go ahead to our support section that I showed you, and you'd be able to see it, or you'd find this slide deck, and then this is a link directly to the Joint Commission announcement. They have a webinar recording there. They have a nice FAQ document there that gives you quite a few details. Now, that said, they have not finalized all the details around this, and they have promised to provide more details in early 2020. Okay. Now, I want to turn to what are the implications for the maternal data center around this. So we are going to be eagerly awaiting the Joint Commission's additional details, and we're going to be reviewing that because we believe that there's a very strong likelihood that with these new submission requirements, hospitals can have the option to calculate the monthly aggregated data for your TGAC reporting purposes for the perinatal care measures. Okay. And if it turns out that we can do this for you, then we would likely develop some special reports right in the maternal data center that give you those exact totals, those exact counts that will be required by the Joint Commission for each of those perinatal care measures. Okay, so we'd make it very, very easy for you to be able to submit that data to the Joint Commission platform. Okay. Now, of course, it's going to be contingent on your hospital making the maternal data center submissions that are required for those measures. And just as a brief highlight, PCO2 and PCO6 can be calculated already in the maternal data center with your required MDC file submissions. For California Hospital, that means as long as you're keeping up to date with your discharge data file. And then we receive birth certificate data from the California Department of Public Health and link it for you. And then we will be able to automatically calculate PCO2 and PCO6. For Wisha and Oregon hospitals, it means keeping up to date with your discharge data and your core clinical files. For PCO1 and PCO5, those two measures do require some supplemental data, and there are two different ways to enter that supplemental data. You can use the chart review worksheets for those measures right in the maternal data center web application, or if you happen to already be gathering those data through an internal system at your hospital, then you can submit those data through supplemental data files. And feel free to visit our MDC support section and see the supplemental data specifications. So the bottom line is we're going to look at those Joint Commission details once they publish them, and we're going to see if it is feasible for us to provide, to play a role in facilitating that data submission for you all. Of course, it's going to be completely optional. as to whether you would want to use the maternal data center for that, if we are able to provide that service. But just wanted to let you know our thinking. We will wait for those details, and then we will keep you apprised as the details emerge. Okay. And then the last thing, because we've already gotten some questions about PCO3 and PCO4 that have been retired as of January 2020 by the Joint Commission. Know that at least in the short term, we're going to continue to include PCO3 and PCO4 in the maternal data center, but we are going to revisit that decision annually. The reason is the Joint Commission has been the measure steward for those two measures. And so every time there's a new ICD-10 coding update, the Joint Commission will update their measure specs. Since they're retiring those measures, of course, they're no longer going to be updating the measure specs. So we're just going to see how difficult it would be for us to continue to update, particularly around newborn BSI, which is very, very code heavy and has literally tens of thousands of codes in it. It's not clear that CMQCC will continue to play the role of keeping that particular measure updated. But we are definitely keeping it for the short term. Okay. Next, I wanted to talk about some initiatives that are going to be coming soon that we are in the process of thinking about building out in the maternal data center. But in order to help us build it out in a way that's going to be most useful to you all, we are going to be asking for some volunteers to help us refine our thinking as we are making the build in the maternal data center. I'm going to go through 4 different projects that are going to be coming soon, and I'm going to describe each in some detail. And then once I finish, then we're going to give you all a chance to let us know if you would like to volunteer for any of them. Okay, so I'm going to start off now with the tracking of the Joint Commission perinatal standards. Okay, so what I was just talking about a couple minutes ago was the Joint Commission's revised requirements for how you report your ORIX performance measures to the Joint Commission. This is a different new Joint Commission initiative where they are now have identified a set of perinatal standards. And they basically took the AIM, hemorrhage and preeclampsia bundles, and they adapted them. And these new perinatal care standards are going to be part of the evaluation process during the Joint Commission's accreditation. So as everybody here probably knows, Joint Commission comes to reaccredit you every 3 years, starting with those that need to be recertified or reaccredited starting July 1, 2020. The Joint Commission is going to evaluate to what extent your hospital has implemented these perinatal standards. Okay. Now, the perinatal standards definitely maintain the spirit of the AIM and the CMQCC hemorrhage and preeclampsia bundles, but the language does differ, okay? So what we are planning to do in the Maternal Data Center is host a new section, and it's basically going to be a checklist that allows hospitals to indicate among all of the new Joint Commission standards if your hospital has implemented it and when you implemented it. Okay. But in addition to providing the checklist where you just check off, yes, we've done this, yes, we've done that, okay, we're going to go one step beyond, and we're going to provide direct links right from that particular standard to any support materials that we think would be helpful in terms of your meeting the standards. So for example, we're going to take you to the toolkit section around OB hemorrhage cards. So you can see a sample list of what should go onto your hemorrhage card. And then in addition to that, we're also going to be providing some CMQCC recommendations about how to sustain that particular policy or practice related to that standard, okay? Because we found it's important that not only do you implement it, but you make sure that you continue to have best practices around each of the standards. So we're going to provide a little CMQCC specific set of recommendations specific to each standard. Okay. We are going to seek your input on the way that we frame this perinatal standards checklist in the Maternal Data Center. And again, we're going to do a little poll in just a few minutes that asks if anybody wants to volunteer to provide feedback on some of our mock-ups. Okay. Next project that we're going to be building. Okay. We are planning to expand the set of breast milk feeding metrics in the Maternal Data Center. The background to this is that in California, there is a law that hospitals either have to be designated as baby-friendly or they have to have adopted the World Health Organization's 10 steps to good breastfeeding practices. So we are planning to help support that, as well as any of you that may be baby-friendly or anybody that just wants to make sure that they're doing a good job with supporting breastfeeding in your facilities. Okay. We're going to be expanding the set of metrics that are related to breastfeeding support. And we are looking for a set of hospitals to participate in a webinar-based working group meeting and provide feedback on which new breastfeeding metrics we may want to incorporate into the Maternal Data Center. So here's the set of potential additional metrics. We won't necessarily do all of these. We want to find out from you all what are going to be the most useful. And then we're going to be looking to you all to also help us to define which data elements will help to support the new metrics. Okay. I'm going to take a pause here and just make sure that I don't have any emergency messages. It sounds like everybody can still hear me. Okay, sounds good. Okay, I'm going to continue on then. Okay. Next initiative. Some of you might be aware that for the severe maternal morbidity measure, we at CMQCC strongly recommend that on a monthly basis, you review all of your SMM cases. Now, most of you have very few SMM cases. It's usually somewhere between 0 and 3 per month. And last year, we developed a worksheet in the Maternal Data Center to help facilitate this review, where you basically click into the SMM case, and then you select from a set of predefined categories about which, if any, issues might have impacted the SMM. And the goal of this is really to help you identify, okay, where can we improve? Is it because we have communication or handoff issues? Or were there missed opportunities in prenatal care? And so if you respond to this case review worksheet, then we're going to sum up for you where the opportunities were by each of these categories. Okay. Now, since we rolled this out last year, some of you all that are already using this have suggested refinements. So we would like to host a working group with a relatively small set of you to, for those of you that are already experienced in using this case review worksheet, understand how you're using the information, what your workflows are around the review process, and helping us identify potential refinements to this particular worksheet. Okay, so this is the SMM case review worksheet. And then next, I'm going to talk about a different project related to severe maternal morbidity. And so just know, if you're volunteering and you want to volunteer, you can sign up for one or both of them. It doesn't have to be both. They're discrete working groups and projects. But for this project, we're undertaking a pilot of a validation study around SMM. And the background to this is, for those of you that do use the severe maternal morbidity rates, you're probably aware that if you're looking at your overall SMM rate, then we have a measure analysis feature that then breaks that SMM rate down into 21 different morbidity categories that basically shows what the woman ended up being diagnosed with. So what were her resulting morbidities? Okay. And that's very useful, but we've also recognized that it's really important to understand what was the underlying cause of that maternal morbidity. As an example, it may be that somebody ends up being classified as having an infection in that SMM measure analysis, but in fact, the underlying cause of the infection was renal failure. Okay. And by identifying the underlying cause, again, this is all about identifying what you can do to improve quality at your hospital. Okay. CMQCC has developed a draft algorithm based on ICD-10 codes, and our goal is to use this algorithm to identifying the underlying cause of the SMM in an automated way for you, which we think would just make it so easy. So no case review needed after we roll out this algorithm. But, okay, we would really like to have hospitals help us test this algorithm that we've developed. And the end goal is when you drill down to see your SMM cases, once we roll out the algorithm, you're going to be able to see not only the final morbidity that they got classified with, but also the underlying cause, again, to help drive your quality improvement. Okay, so the ask here for volunteer hospitals is to help us test this new algorithm. The pilot would start in February. What are the requirements? Okay, you would need to designate a clinician to review all of your SMM cases to ascertain the underlying cause, and we will provide a guide to help with that. And then you would document the underlying cause in the Maternal Data Center case review worksheet. Again, remember, 2/3 of you all have fewer than 3 cases per month. Okay, so it should not be a big lift. Okay. There are about 20% of you that have between 4 to 8 cases per month, and then there's a pretty small handful that have 9 or more SMM cases per month. Okay, and you can go in and look, you can see how many just by looking at your SMM measures in the Maternal Data Center to inform your decision. Okay, okay. So here's the summary of the 4 different volunteer opportunities. Connie is going to launch an online poll right now. Again, no pressure, but if you are interested in any of these, go ahead and let us know. And then we will, this particular question is not anonymous. So it should record your email for us, and then we will be in touch with you. Okay, I'm going to go ahead and move on. But no, if you need to think about it and you're not sure right now, email us at datacenter@cmqcc.org, or you can click Contact Us from the support section and just let us know which activity you'd like to volunteer for. And again, here's the summary right here. Okay, now we're going to go to a new feature in the Maternal Data Center. We rolled it out in early December, so it has been around for a while, but nobody started using it yet, and that's okay because we hadn't introduced it formally yet. It's about submitting a second patient identifier. Now we're going to go pretty nitty-gritty here. Do know that we have a user guide about how to do this in the Maternal Data Center support section. It's called Adding a Second Patient Identifier. So please, I'm going to go pretty quickly through this, because some folks won't be particularly interested, but know that that user guide is there. Okay. Here's the background. When you all submit files to the Maternal Data Center, in your file, you include either a medical record number for each patient or a patient account number, like a HAR number or a FIN number. And then in that way, when you drill down to the patient level, like in this example, you will see the label, either MRN or account number, and you are able to see the patient's MRN or account number depending on what you've submitted. And then you can more easily do a lookup in your internal systems. Okay. Up until December of last year, you could only submit one patient identifier per case. You are now able to submit 2 patient identifiers for any case. Now, you do not have to submit a second identifier. It is completely optional as to whether you do or not. Know that some of you are fine with only one. Great. Others of you have asked us to allow you to submit 2. Okay. For those of you that are interested in that or want to know why you might be interested in that, let me give you 3 reasons why this might be helpful for you. First reason is in the patient drill down screens, you can really easily toggle between the 2. Okay. So in this example hospital, as the default patient ID, this hospital is submitting medical record numbers. So when you go to a patient drill down screen like this, you see the medical record number label, and you see the MRN for each patient. And then if you click into the green number there, then you can go see the patient level, the more detailed patient level data for that patient attached to that MRN. Okay. Now, let's say some of your users really like to do lookups using account numbers instead of MRNs. So in that case, from this drop-down menu, up at the top of the patient drill down screen, you can open it up and you can scroll to account number, click on account number, and I'm going over to the right-hand side of the screen now. And as soon as you click on account number, it will then change. So the label will say account number, and you see the patient's account number instead of their MRN. And again, if you clicked on that number or whatever it is, alphanumeric, you'd also see the patient level details for that patient associated with that account number. So that's one reason, just easier toggling between the 2. Okay. Second reason, and we think this is probably the major reason, okay, if you submit a second ID, okay, if you all ever download patient level data from the maternal data center in order to analyze more on your end, okay, then in that patient level data download, both record numbers will automatically be included. So in this example, you'll be able to see in the download both the mother MRN and the account number, the newborn MRN and the newborn account number. And the reason for this is if you then want to download data out of the MDC and link it to other internal data sets like billing data, blood bank data, and maybe that blood bank data only uses account numbers, this is going to enable you to more easily link the MDC data to your blood bank data system as an example, okay? Because you're going to have both types of patient identifiers. And then the third reason is if you do submit that second ID, it also provides flexibility in terms of uploading different data sets to the maternal data center. So maybe you've always included an MRN in your discharge data file, but now you want to start uploading supplemental data files on transfusions, but your blood bank data system only has account numbers. Okay. If you had decided to submit 2 different patient IDs, then you don't need to do the crosswalk before you submit that blood bank data file to the maternal data center, because we can now automatically link it given you already submitted both types of IDs. Okay, so it makes it easier in terms of you don't need to do crosswalking with every single new transfusion data file, for example. Okay, how does it work? Okay, we have a new report in the maternal data center called the patient ID report. This slide just tells you how to access that patient ID report. So these are just the steps for people with MDC administrator roles versus data entry roles. Just know that that's here for you, and it's also in the user guide. Here's what the report looks like. Okay, it shows the Once you get there, the first thing it shows you what your setting is in terms of what your hospital has set to be your primary or your default patient ID setting. Okay. And basically that means when you go to the patient level drill down, okay, it is what defines what label is shown in that patient drill down. Whatever you've set is what shows up here. Okay. So in this report, we show you what your setting is. The second bullet shows you where to change it if it's wrong. Okay. And then it also shows you to what extent you've already uploaded MRNs versus account numbers to the maternal data center. So at this point in time, your hospital is very likely to have 100% medical record numbers or 100% account numbers, and not both, okay, at this point in time. As some of you start to use it, then you will see both MRNs and account numbers populated. But right now, one of these two sets of big columns probably says 0% for everything. Although some of you have switched back and forth between MRNs and account numbers over the years, okay. There's going to be a row that shows what percent of your records had MRNs. For mothers, what percent of your newborn records had MRNs submitted. Ditto, what percent of your mothers had account numbers submitted. What percent of your newborns had account numbers submitted. Again, one of these two is going to be 0%. And then we also show you a sample patient identifier. And the reason for this is to make sure that this is really an MRN and not an account number, okay? Because it may be you see that says medical record number here, but when you look at the sample, you say, no, that's not an MRN, that's a HAR number, that's a FIN number, okay? And in that case, you will need to change it because this is being driven by your patient ID setting, okay? Now, what happens if it turns out it is incorrect? There are actually two steps. One, it's really important that you contact us because we're going to need to do some work in the background and let us know whether it's every single month or if it's some range of months that have the incorrect setting. And then on your end, you will change your setting right here using this link. But don't forget to contact us as well because we do need to do some background work if you are changing your setting at this point in time. Okay? Okay, let's say you've decided you do want to submit second patient IDs. How do you do it? There are three different options. One important thing, in your core patient discharge data file, okay, make sure you continue to include at least one, okay? Either a medical record number or an account number, okay? Then you have three options for starting to add the second one, okay? You can either start to include the other one in your PDD file, okay? And just make sure to label one MRN and one account number. Option two is to use a separate supplemental file. And this is the option you want to use if you want to do any of this for retrospective data. This is the must-use option. And be careful. So if you use option 2 or option 3, then as you assign that second patient ID, you need to make sure in that CSV file you submit to us that you use assign as part of the column header. Okay, and ditto for number 3, if you're already submitting a supplemental file on a routine basis, or you're an Oregon or Wisha hospital submitting a core clinical file, then you can assign a second patient ID as part of that process. But again, you're going to need to make sure to include the word assign in your column header. Now, this is really nitty-gritty, and we're running out of time. Know that there's a user guide that goes into this in detail, and of course, we are happy to help support you as you decide to do this. Okay? And then again, if it turns out you've started submitting second patient IDs and you want to figure out, well, did I cover everybody? Then this patient ID report will show the number in red if there are fewer than 100%, but greater than 0%. So it looks like you tried to submit some second patient IDs, but didn't necessarily cover everybody. And then if you click into that 16.7%, you would be able to see the list of cases that you did not submit the second identifier for. This is all covered in our user guide. Again, if you download this particular slide deck, then this link will take you right to our user guide, or you can find it under our support data submission section. It's called Adding Second Patient Identifiers. Okay, that takes us to the end of the features for all three portals. But for California hospitals, let me make a few quick announcements. First thing specific to California hospitals, there is something in the maternal data center that we call the RPPC report. The background to this is the California Department of Public Health operates something called Regional Perinatal Programs of California, acronym RPPC. Each California hospital has an RPPC coordinator assigned to your hospital. Their goal is to help provide support for your quality improvement activities. They come out and make site visits on an annual basis. They're probably communicating information to you on a regular basis about resources that are available. They're there to help you. To help support the hospital RPPC relationship, CMQCC provides confidential reports to the RPPC coordinators. Okay. Now the report looks something like this. It's a 4 to 6 page report, okay, that shows a set of maternity metrics. So for example, race ethnicity distributions, percent of Medi-Cal cases. If you were to go to the second page, you'd see NTSV C-section rates. Shows your hospital's data, as well as some benchmarking data. Okay. And then brand new this year, we are now including CPQCC data. So for those hospitals that have NICUs and they submit data to our sister program CPQCC, then there is now the last 2 pages now encompass the CPQCC data, and it looks something like this. Okay. Now, really importantly, okay, again, these reports are totally confidential. We have 2 different types of reports for the RPC coordinators. There's what we call the standard report, where we are using the data that we get directly from the state to CMQCC. And the state data tends to be older. Okay, and as you can see, this is what a standard report looks like. So it shows 2016 and 2017, but not 2018, because at least when I made the screenshot, we did not have the state data for 2018. Okay, we do now, but we didn't when I made the screenshot. Okay, so it's always going to be older data. And because we're getting the data from the state, then your hospital did not need to authorize us to share this data with the RPPC coordinator. Okay. But there's an enhanced report option that is based on more recent data that your hospital has submitted directly to CMQCC and or CPQCC. And here's the difference. Standard report does not have the most recent year, but if you were to choose to give us authorization, then your RPPC coordinator would see the more up-to-date data. And this really helps them help you, because they are there to help connect you to resources that are available from CDPH and across the state. So if they have your more up-to-date data and know maybe you're struggling with severe maternal morbidity, they can help to connect you. Okay, how do you get them the authorization? In the maternal data center, first, to help inform your decision, know that you can go over in our By Reportingorg tab, okay? There are going to be a list of different organizations. The last one you'll see is for RPPC. There's a button here that says PDF report. If you want to see what this looks like before you decide whether to authorize or not, just click that button. You can see exactly which metrics are included in the report. Then, if you decide you want to go ahead and make the authorization, you'll click these links. There's an authorization for the CMQCC metrics and a different authorization for CPQCC. Okay, make sure you do both if you do want to authorize both, okay? And you're basically going to go to a screen and then you will complete the data release authorization form for both. If your hospital's already done the maternal authorization, it's going to show as a view authorization. That means you've already done it. If it shows complete data release authorization forms, it means you haven't done it yet. Okay. Now, this authorization has to happen in the maternal data center, okay? We don't take faxes or anything like that. And it happens and it occurs only with people that have an administrator role in the MDC, okay? But because this is happening in the MDC, if you are a hospital that has a NICU that submits data to CPQCC, we highly recommend that your MDC admin go to the neonatology department leadership and make sure they're okay with this idea of you authorizing the release to the RPPC coordinator. So please do connect with your colleagues. Okay, that's the RPPC report. And then just to wrap things up, California hospitals again, tomorrow you are getting your annual member invoice for calendar year 2020. As you can imagine, we hope you'll, each hospital has 1 to 2 invoice contacts that have been designated. Be on the lookout for that. And of course, we always appreciate as timely as you can be with those payments. We'd be very, very grateful. And then lastly, just wanted to make sure you're aware of the public reporting schedule for Cal Hospital Compare. As I think almost everybody's aware now, because we're sending out a lot of emails about it, there are 4 different maternity metrics that get publicly reported on Cal Hospital Compare. We are now doing this every 6 months. And because we're doing it every 6 months, we're always in a sort of a constant cycle of getting you to finalize your data submissions and letting you know when Cal Hospital Compare is publishing the data. And this can get a little confusing because of this 6-month cycle that needs a lot of lead time. So I just want to summarize what's happening right now. So right now, if you were to go to Cal Hospital Compare's website, you will see the calendar year 2018 results, okay, up on the website. And that's what the honor roll that was published by Health and Human Services in December used the calendar year 2018 results. Then the results for your rolling 12-month period from July 2018 to June 2019, we sent to Cal Hospital Compare at the beginning of the year, and they will be posted by the end of this month. Okay, so they're going to replace the 2018 results by the end of this month with the updated. And then at the same time, we want to make sure that you are making all of your calendar year 2019 data submissions to the maternal data center. So make sure that you finish off all your PDD submissions no later than March the 15th of this year. Then once we have that, then we will notify your departmental leadership of the results so they can review them. By April 30th, you notify us if there are any corrections to the underlying data, and then we'll send it to Cal Hospital Compare. And again, they'll update their website sometime this summer. Usually it's end of June or early July. Okay, so that takes us to the end of the presentation. I apologize for going over a few minutes. I will, if folks, Connie or Emily or Aaron, are there any questions, if people did want to stay on, that it would be useful to go over over the phone?
I think we covered pretty much everything. Emily, if there are any other ones you thought were useful, please let us know.
I think we're good. I know that some people messaged us anonymously, and so if you do want to email us, you can use that data center at cmqcc.org, and we might be better able to address your questions.
Okay, great. We do hope you'll take just a couple seconds to let us know how useful this meeting was. So again, we like to take QI to heart as a QI organization. So please, that'd be great if you could respond to that poll as well. And this one is anonymous. Okay, thank you all for attending. We really, really appreciate your attendance, and we look forward to continuing to work with you in 2020. Take care.